Well, I think the obvious thing would be that the person looks very sad, maybe is very tearful and crying a lot. But there's other signs that we want to look for that maybe aren't so obvious. Hopelessness, helplessness, losing pleasure in things that used to give you pleasure, either sleeping too much or not sleeping enough. Early morning awakening is a hallmark symptom of depression when someone wakes up between the hours of 3 and 5 in the morning with a feeling of doom and gloom. Appetite, they're either eating too much or not eating enough. If these symptoms persist over a 2-week period, we may be talking about clinical depression, and the person does need to get assessed for that. I think the most important thing to do is to get a professional assessment, because depression, once again, can hide in many different ways. For men, sometimes depression shows up as very irritable, or that they have maybe a lot of physical problems going on. For a teenager, it may show up as their behavior is unacceptable. So it's very important to get a professional mental health worker to assess you, and also to rule out if there's maybe some other physical problems going on, like diabetes or thyroid problems, which may also be causing the depression. There's several different types of depression. One is called dysthymia, and that means kind of bad mood. That's like a low-grade depression that someone would have maybe over a longer period of time. It's not as debilitating as a major depression, but it has a profound effect on their life because they never feel really good. Then there's major depression, and one of the ways that we want to look at major depression is, does it last longer than 2 weeks? Bipolar illness is a combination of depression and mania. And of course, there's many different types of bipolar illness. Sometimes people have the mood swings that are long-lasting, some it's a rapid cycling. Postpartum depression would be, when a woman has, after she has a baby, and many women experience this, but sometimes it's very short and it's not as, debilitating as someone who has a severe postpartum depression, which can be, and they can become psychotic. Many of us experience loss and grief when we have losses in our life, and that's not necessarily depression. However, loss and grief can turn into depression, and once again, an assessment is really important to see if it's clinical or not.